Hello, my dear friends. If you or someone you love is living with kidney problems, diabetes, or high blood pressure, I want to first say, you are not alone. I know how overwhelming it can feel. The fear of dialysis, the worry every time you see your creatinine levels go up, it can feel like there's no way to stop it. But please, don't lose hope. Today's video is made just for you. We're going to talk about something many people have asked me. Can baking soda really help lower creatinine and support your kidneys? And if so, how do you use it safely at home? Many of you have written in with questions like, how much baking soda should I take? Is it safe for my kidneys? Can it really help me avoid dialysis? These are important questions. And in today's video, I'll do my very best to answer them in a way that's simple, honest, and easy to understand, without all the confusing medical talk. Now, I want to be clear and gentle here. There are a lot of videos online. Some give good advice, but others may oversimplify things or even suggest remedies that could be harmful, especially for someone with kidney problems. So before we talk about how to use baking soda, we need to understand why it may help and how your kidneys actually work. When you know the basics, it becomes easier to make the right decisions for your health, and that's what we want, to give you back a sense of control. And friend, if you find this video helpful, click the share button below or send it in an email, because good information should never be kept to ourselves. Let's begin. Let's begin with the most important. Can kidney damage be reversed? Now, I know many of you are hoping for a clear yes or no. But the truth, dear friend, is a little more complicated. Some types of kidney damage can heal. Some can't. And it all depends on a few important things. What exactly caused the damage? Which part of your kidney was affected? And most importantly, whether that cause is still harming your kidneys today. So let's take this one slow step at a time. You see, your kidneys are more than just filters. They're like quiet workers in the background, filtering your blood, balancing your minerals, removing waste, and even helping control your blood pressure. Inside each kidney, there are over 1 million little filters. They're called nephrons. Think of them like tiny tea strainers, delicate, but smart. They let the bad stuff out, and they keep the good stuff in. Each nephron has a special part called the renal tubule, and this is where the magic, and the danger, happens. When these tubule cells get hurt, maybe from too much sugar, too many pain pills, or not enough oxygen, they swell up. And just like a blocked pipe in the kitchen, a swollen cell can clog the whole system. That means the kidneys stop working the way they should. If the cells are injured but still alive, they have a chance. They can heal. Slowly, gently, they may begin working again, if we take away the cause of the damage and give them a better environment to recover. According to Harvard Health, the kidneys have a limited ability to repair themselves if the cause of the injury, like dehydration, high blood sugar, or certain medications, is removed in time. Let me share a real story here. Frank, a retired truck driver from Ohio, was diagnosed with CKD stage 3. He was exhausted, afraid, and overwhelmed by all the advice online. But when he stopped taking certain over-the-counter painkillers and reduced the salt and meat in his diet, his doctor noticed his creatinine level dropped slightly within 3 months. Was it a miracle? No. But it was progress. He didn't reverse the disease overnight. But he slowed it down. And sometimes, my friend, that's all we need, to slow it down. You may have heard, kidneys can't heal. Once it's gone, it's gone. Some doctors may tell you that chronic kidney damage is permanent. That's true in some cases, especially when the nephrons are completely destroyed. But what many people don't talk about is this: the remaining nephrons can adapt. They can pick up the slack. This is called compensatory hypertrophy, and it's the body's natural way of surviving. Like when one person in a household takes on more chores because another is sick. A study from Johns Hopkins found that improving blood sugar control and avoiding NSAIDs, like ibuprofen, can significantly reduce further nephron loss, especially in older adults. Remember how each filter inside your kidney is connected to a little tube? That tube is like a narrow country road. If it swells or collapses, nothing can pass through. That's essentially kidney failure. The body loses its ability to filter waste and toxins from the blood. If only a few of these filters fail, it's not the end of the world. Your body has a remarkable ability to adapt. But when too many stop working, the needs of your body are no longer met. That's why doctors divide kidney disease into 5 stages, like chapters in a long book. The more filters you lose, the more serious the chapter you're in. There's a window of time, usually around 3 months, where the damage might still be reversible. This is what doctors refer to when they say chronic kidney disease, or CKD. Once you cross that 3-month mark with poor kidney function, some damage may be permanent. But here's the good news, and please hear this like it's coming from a friend who truly cares. Even if you've been told you have CKD, not all hope is lost. You have 2 million filters between both kidneys. And research from Johns Hopkins confirms that even if you lose half of them, you can still live a full, energetic life if the damage stops progressing. Let me tell you about James, a 62-year-old teacher from Georgia. He was diagnosed with stage 3 kidney disease. His first reaction? Fear. Anger. Helplessness. But instead of giving up, James adjusted his diet, walked every morning for just 20 minutes, added baking soda carefully, with his doctor's support, and kept his stress low. After 1 year, his GFR went from 45 to 58. Not perfect, but enough to live normally again. Before we dive into the home remedies, let's talk about the critical steps you can take to preserve your kidney function, especially if you've been diagnosed in the early stages of kidney disease. The earlier you begin addressing it, the better your chances are for a healthier future. But even if your diagnosis came at a more advanced stage, don't lose hope. Many people with chronic kidney disease still enjoy a good quality of life with the right care and lifestyle adjustments. There are several causes of CKD, but regardless of the cause, some essential recommendations can help delay kidney failure and possibly avoid dialysis or a transplant altogether. In the U.S., the 2 leading causes of CKD are diabetes and high blood pressure. That's why managing, or better yet, preventing, these conditions is key to protecting your kidneys. What can you do to slow down kidney damage if you're living with diabetes? The most important step is to keep your blood sugar levels within a healthy range. Your doctor may prescribe specific medications, and it's crucial to follow those instructions closely. In many cases, these prescriptions include a class of drugs known as ACE inhibitors or angiotensin receptor blockers, ARBs, which are typically used to treat high blood pressure. Interestingly, studies have shown that these medications can help protect kidney function in people with diabetes, even if their blood pressure is normal. Additionally, your hemoglobin A1C levels should ideally stay below 6.5%. And don't forget, kidney function tests should be performed at least once a year. Of course, every patient is different, so always follow your doctor's personalized advice. If you have high blood pressure, it's important to aim for a reading of 125/75 millimeters of mercury or lower, especially if you have kidney problems but don't have diabetes. For those with both conditions, the target is usually 130/85 millimeters of mercury or less. Now, why am I telling you all of this before getting into home remedies? Because no natural remedy will work if diabetes and high blood pressure are not well controlled. Your kidneys can't heal if they're under constant attack, 24 hours a day, 7 days a week. Other critical steps include following a healthy, balanced diet, losing excess weight, and staying active. These lifestyle changes are fully within your control, and they are powerful tools for improving your overall health. In fact, many people with type 2 diabetes have been able to reverse or prevent the disease entirely by adopting these habits. Those with high blood pressure are also advised to limit sodium in their diet. Reducing your intake of protein and phosphorus may also help slow the progression of kidney disease. Ongoing research is also exploring how certain foods and supplements might help protect the kidneys. For example, fish oil has shown promise, particularly in patients with IgA nephropathy, a type of kidney disease, but it may also offer benefits to others with CKD. Antioxidant and anti-inflammatory supplements, including specific vitamins and nutrients, may support kidney health in various stages of the disease. What about baking soda? Now, let's get to one of the most frequently asked questions. Can baking soda really help lower creatinine levels, and how? It's a fascinating question, but not one with a simple answer. Baking soda, or sodium bicarbonate, may be helpful for some kidney patients, especially those dealing with metabolic acidosis, a common complication of advanced CKD. Several studies suggest that sodium bicarbonate supplementation can slow the decline of kidney function in these cases. But again, it's not for everyone, and it must be used properly and under medical supervision. So yes, baking soda can be part of a helpful strategy, but only if it's used the right way, and only in the right circumstances. What is metabolic acidosis, and why does it matter? Metabolic acidosis isn't the same as acid reflux or heartburn. Instead, it's a condition where your blood becomes more acidic than normal. This happens frequently in people with chronic kidney disease because their kidneys can't efficiently remove acid from the body. When this imbalance occurs, it disrupts the body's acid-base equilibrium and can accelerate the progression of CKD. It may also increase the amount of protein in your urine, a sign that the kidneys are under greater strain and damage is occurring more rapidly. Common symptoms of metabolic acidosis include deep, rapid breathing, fast heart rate, headaches and/or confusion, muscle weakness, extreme fatigue, nausea or vomiting, loss of appetite. However, not everyone will show symptoms. Here's the concern: when acid builds up excessively in the body, it causes even more damage to the kidneys. So in essence, it's a kidney-related condition that ends up harming the kidneys even more. Understanding this highlights just how important it is to manage metabolic acidosis effectively. If left untreated, it can lead to bone loss, osteoporosis, hormonal imbalances, and muscle wasting. That's why the idea of addressing this condition with something as simple as baking soda is so powerful. But how does it actually work? Baking soda, also known as sodium bicarbonate, is an alkaline substance. It helps neutralize the excess acid in your body, the same acid responsible for many of these complications in the first place. However, taking baking soda as a supplement is not something you should ever do without medical supervision. Just because you read about it here doesn't mean you should start taking it. Baking soda can have side effects like nausea and bloating. It also contains sodium, which can raise blood pressure, a serious concern for people with kidney issues. So it's important to know. Baking soda can be helpful, but only if you actually need it. Not everyone with kidney disease has metabolic acidosis. Even though it's common, it doesn't affect every patient. So what should you do? Should you take baking soda, or avoid it altogether? There's a simple solution. Get your bicarbonate levels tested. Ask your doctor for a CO2 blood test, also known as a bicarbonate test. This test is often included in a basic metabolic panel, BMP, but not always. So make sure to ask your doctor and confirm that your CO2 levels are being monitored. Normal CO2 levels typically range from 23 to 29 milliequivalents per liter of blood. The reason I'm emphasizing this is because managing metabolic acidosis is one of the most effective things you can do to protect your kidneys and lower your creatinine levels. Many people believe that baking soda helps treat kidney disease. That belief stems from its potential to correct metabolic acidosis. But there are other steps you can take to avoid this condition and support kidney health. The first step is, once again, get tested. Because if you're not dealing with metabolic acidosis, baking soda won't help. So speak with your doctor. Review your blood work. And take informed action. That's how you start improving your kidney health today. If your bicarbonate level is 22 milliequivalents per liter of blood or lower, you're outside the normal range, and it's time to take action. So, let's say you've been tested and you do need baking soda. How should you take it? And what's the right dosage? Baking soda, sodium bicarbonate, can be taken either by mouth or dissolved under the tongue. Modern nephrology experts recommend starting with a low dose of sodium bicarbonate to see how your body responds. A good starting point is 1/2 to 1 teaspoon per day, then adjust based on your follow-up blood test results. Some patients also prefer taking sodium bicarbonate tablets, which are typically 650 milligrams per tablet. These are available at most pharmacies. However, you can also use regular household baking soda, the kind you find at any grocery store. It may taste a little harsh, but it's inexpensive and easy to access. Important tip: take sodium bicarbonate on an empty stomach, between meals, to reduce the risk of bloating or gas. So, speak with your doctor, request a CO2 bicarbonate test, and if recommended, begin with a low daily dose. Then, during your next round of blood tests for CKD, check your bicarbonate levels again. If there's improvement, or not, your doctor can adjust the dosage accordingly. Now, to answer the big question, can baking soda help you avoid dialysis? The short answer is, potentially, yes. Sodium bicarbonate has been shown not only to slow the progression of chronic kidney disease, but also to support heart health, reduce muscle wasting, and delay hormonal and skeletal complications. But, and this is crucial, you should never take sodium bicarbonate or any supplement without your doctor's guidance. And don't forget, even if you're prescribed sodium bicarbonate, it's just one part of the puzzle. You should also be following a kidney-friendly diet to truly support your health. In fact, in this video, you'll find plenty of practical tips to help improve your nutrition with the best kidney-friendly food choices. That's it for today. Thank you so much for watching, and take care of your kidneys.